All right, guys. Good morning. Welcome back to the Weiner Wellness Week. I'm Dr. Philip Ross, a chiropractor, sports rehabilitation specialist, and a certified chiropractic sports physician. And today, for basically this morning, what we're going to talk about is the Class 4 therapeutic laser. So, we are getting a ton of great results from the laser, whether it's chronic pain, acute pain, injury healing, wound healing. And today, we're basically just going to go into some specs about it, the history of the laser, and what it can do for you. So, history of the laser. Actually, as early as the early 1900s, Albert Einstein discovered the light had some special properties, and he later explained in 1917 the theory of stimulated emission, which became pivotal for laser therapy today. And there's a ton of different healthcare providers that use lasers, and there's multiple classes. So, what we use here is a Class 4 therapeutic laser, which actually helps promote healing. Um, Different dental offices use lasers for kind of like cutting and just different other things as well. But basically, what we use ours here for is just all healing. So, and it all goes off the basis of the stimulated emission, which basically an incoming photon has a specific frequency, and what we do is we excite an electron, and it will basically drop to a lower energy level, and that's basically how we get all our energy. So actually in 2003, the FDA first approved the class 4 laser therapy usage in the US. How it works. The biggest thing is the laser basically emits photon energy. So what we're trying to do is take photon energy, deliver it to the mitochondria of the cell where it interacts with what's called the chromophores. So the biggest thing is we have the laser over skin directly because it can't actually penetrate any kind of clothing. So if we laser over the skin, the photon energy is going to react with the mitochondria, more importantly, the chromophore in the mitochondria, and this basically produces ATP. So, how that works is it will hit the chromophore, and then we have a reaction, and you produce adenosine triphosphate, which is your cellular energy. And basically, what we're doing is we are converting photon energy to biomechanical energy here. Okay, so laser therapy. If you want to Google it or look up any kind of studies, the term is used photobiomodulation, which is basically a fancy word for how laser therapy reacts with the human body and tissue within the human body. The best analogy how a laser works is just how sunlight hits a plant for the plant to grow and heal. We are donating the photon energy to your body, the mitochondria, more specifically, those chromophores we were talking about, so you can heal and grow and just heal quicker than normal. Um, we heal and repair quicker because what the laser does at the cellular level. The chromophore is called photosensitive, so it's very reactive to light. And so when we actually penetrate that, we have a ton of biomechanical changes that will actually occur. So one of the biggest ones is the increase of adenosine triphosphate, ATP. That is your cellular energy. So that's basically all the metabolic reactions that happen in your body. There's also increase in nitric oxide, which results in vasodilation. So it will help with microcirculation. So if you have any kind of acute injury, for example, let's just take tennis elbow as a really easy one. If you have tennis elbow and we get the photon energy from the laser over that lateral epicondyle in your elbow, basically what it's going to help with is the microcirculation to get all your body's natural stem cells to the area so you could grow and heal quicker. It also affects the calcium ion channel on the nerve and cell. So how that works is, so let's take a very good example, sciatic symptom, right? So you have pain in your back or in your glute running down your leg. You have three channels on a nerve: a calcium, potassium, and a sodium ion channel. What the laser therapy does, the photon energy, um, it affects the calcium ion channel on a nerve. So think of a straw with a bunch of holes in it. It's a leaky nerve, so it keeps depolarizing, and you keep feeling that sciatic symptom running down your leg. Essentially, what the laser does is it plugs up the holes in the straw so you have a better connection, so you don't have the ridiculous symptom, that leaky nerve running down your leg. This helps a ton of people, whether it's neck pain running down their arm or low back pain running down their leg. Coupled with the laser therapy and a couple corrective exercises that we do here, those symptoms drastically diminish. The biggest thing for me is when someone comes in, doc, my back's killing me. I feel it running down my leg. I went to an ortho. They want to do a discectomy or laminectomy and any kind of lumbar surgery. The answer is always try this first before you go into the knife, because the success rate of low back surgery is not too great. So It also helps in the release of growth factor. So again, it's just going to facilitate your body to heal as quick as possible. It will also alter your pain threshold. And basically the last thing it does is it produces heat. So that's one of the byproducts, is that basically the only byproduct from the laser. And we actually get heat from tissue saturation from the photon energy entering the mitochondria of the cell. And we actually use heat in our favor. So once any kind of collagen, so basically all skeletal muscles collagen, once it's heated up to around 100 degrees, it becomes a little bit more pliable or mendable. So it's just the same as if you're trying to bend cold rubber as opposed to hot rubber. So once we get the tissue heated up, it's just a little bit more mendable. So then when I do some soft tissue therapy, so for cupping, grasping, any kind of stretching, it's just going to allow your muscle fibers to, instead of being all knotted up, it's just going to allow everything get more linear, so everything relaxes and gets longer. Okay, so big article that came out in the NJAM, New England Journal of Medicine. This basically talks about the cytochrome C oxidase. So, long story short, what happens is when we get the photon energy into the chromophore, it allows for an upregulation of the cytochrome C oxidase and hemoglobin oxygenation. So, long story short, fumbling that one today, Phil. So, long story short, we are delivering more oxygen for the cell. So, this study came out in 2016, and basically what it said is that we enhance the capacity for cellular oxygenation metabolism. So every metabolic process that essentially needs oxygen, we're delivering oxygen to the tissue, so you just heal quicker. And this actually talks about like what it does for your brain. So there are actually a couple different studies, and especially this one in 2016. They basically talk about they long story short, they got laser therapy and they actually did it over your forehead to kind of hit the prefrontal cortex of your brain. And what they found was that lasering low light level laser therapy over the forehead benefits cognitive ability, enhances attention, working memory, and it just helps execute functions more efficiently. So basically, what we're essentially trying to do is deliver energy to your brain, so you just feel better cognitively. And that actually came out. That was a huge study for the laser therapy, just because it's not widely studied, especially in the United States. Overseas, over in Europe, it is, but not too many studies over here in the United States. Yeah, yep. So we have a class 4 laser. So it's a 60-watt laser, so it actually can penetrate up to 2.4 inches into your tissue. Yep. So that's why when people are like, "Well, doc, I just feel the warmness kind of over my hip. Let's just take hip pain." If you actually, go 60 watts, it will penetrate actually deep into your hip joint. Yeah, and absolutely. So if you have any kind of like acute inflammation, it's just going to zap your inflammation, and it actually helps to alter the pain threshold, so you don't experience pain all the time. Yep. A couple other physiological effects from the laser. It's a reduction of interleukin 1, which is a pro-inflammatory mediator. So again, it's going to decrease inflammation at the cellular level, which a lot of times pain is just inflammation. Inflammation is the root cause of a lot of pain. It will also facilitate faster tissue repair, faster wound healing. So one of the first instances I saw where the laser worked was when I was in grad school out in St. Louis. We had a quadriplegic, and he was basically in a wheelchair. He's been there for, I think it was 12 years. He was in a wheelchair, and he developed an ulcer on his heel. He went to every ologist you could think of. And he finally, last ditch effort before getting his leg amputated, he came to our clinic over in St. Louis. And we had a class 4 therapeutic laser at the time. And we treated him twice a week for 15 weeks. And it closed the wound on his heel, and he did not have to get his foot amputated. That was the first instance that I saw, because I'll be honest, when I was in grad school, I was skeptical. I was like, that's just a red light. What's this really doing? But once we saw this close up his wound and he did not have to lose, he was going to lose below his knee. That was a huge win for me. So as soon as I came out of school, that's one of the modalities I really, really like to use. Just because it facilitates healing. So faster tissue repair, faster wound healing, especially in diabetic ulcers or open sores. That's actually it was first used for, just closing wounds up. It could also help with neuropathy and shingle symptoms. There's a certain setting and a certain wavelength that will help with that. Increased tissue oxygenation, got it right there, Phil. And it can actually accelerate nerve regeneration. So, a lot of people too post-op, let's say shoulder surgery, and doc, I have a little bit of numbness right on my skin over here. Everything else feels fine, but I just feel local numbness. What it's going to do is, we were talking about that calcium ion channel. It's going to facilitate and open the calcium ion channel so the nerve just responds quicker, because generally nerves take a very, very long time to heal. So that's another massive pro of the laser therapy. And then right here is basically just a little depiction of what the laser does. Um, so what it can be used for, any kind of, if you go to a doc or if you have a diagnosis that ends in itis, itis is just the suffix for inflammation. So any kind of inflammatory disorder, this is going to help with. So lateral epicondylitis, so your tennis elbow, medial epicondylitis, Achilles tendinitis, rotator cuff tendinitis, anything ending in itis, it's going to work, because again, it's going to decrease the inflammation, and that's basically all that is. It's just inflammation of a tendon or a sheath causing pain. Um, Joint sprains, muscle strains, again, we're going to decrease the inflammation and promote the healing at the cellular level by increasing adenosine triphosphate, your cellular energy. So you were just going to heal, honestly, close to like 100 times quicker than what you normally would. Um, Diabetic neuropathy symptoms. So I treat a lot of patients right now. You have to have an A1C that we could work with, an H1AC. So if you're coming in, your H1AC is over 10, the laser therapy is not necessarily going to take away the numbness in your feet. But if you have an H1AC that's actually, right in around 6 or 5.5, if we get the laser therapy coupled with the glucolyze, magnesium, pro oranges in our neuropathies supplementation, I can't guarantee, but it's not uncommon for someone to get their H1AC tested and get on the supplement protocol and it drop a couple points, and then it'll actually help with the symptoms of your diabetic neuropathy. Again, because we are turning open the calcium ion channels on your feet, so you just feel more comfortable in your skin, and we're trying to create the connection from your brain to your foot, and so you don't feel the numbness in your foot as much. And so we'll do that with the laser, and then I also do with different therapeutic exercises. So we have cupping therapy, we have Graston therapy, and I do something called FST, Fascial Stretch therapy, which just kind of opens everything up just to give the nerve room to breathe. So we're going to fix the nerve at the cellular level with the laser, and then we're creating space for the nerve to breathe with different kind of stretches. So the ART and the FST. That helps with acute and chronic pain, can help stave off arthritis getting worse, and bursitis. So again, itis meaning inflammation. We're decreasing inflammation locally just so you heal quicker. The main reasons that I use the laser for like different joints is the inflammation. Inflammation's key. And let's just pick something. For example, let's pick a shoulder injury. So, doc, the past couple months, like anytime I go to pick like a coffee mug out of my cabinet, I kind of feel like a tight pain here, and then it kind of runs down to my arm. Without getting an MRI and just going through an exam, usually that could be kind of like a rotator cuff tendinitis. You have 4 rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. Your most commonly injured rotator cuff muscle is going to be that supraspinatus rotator cuff. And a lot of times patients present with the pain in their shoulder running down their arm, kind of down to their elbow. So what we do is, after a thorough assessment, we will start with the laser therapy to kind of get the inflammation out of that rotator cuff tendon, that tendinitis that's happening. And then we were talking about earlier, the heat as our benefit. So once we heat that collagen up, and then we get our different tools like the Graston tool, the scrapey tool, and the cupping therapy, it's just going to allow the tissue to just work with us a little bit more efficiently. So we'll start with the laser, do some modality work, and then I do a lot of, it's called pinning and stretching. So if you have a supraspinatus injury, your shoulder will naturally kind of roll forward, and it will kind of dump pressure on the back of your shoulder. So what we do is pin and stretch. So I'll basically shorten the muscle, pin down, and stretch it back out just to kind of create some more length in the muscle. So just biomechanics, hopefully your shoulder, instead of being rolled forward, will kind of naturally roll back. And usually how that works is when we treat someone for any kind of rotator cuff tendinitis, we will get the pain. We're trying to get the symptoms to centralize. So the pain out from the distal extremity up into the actual source, and then it will go away. How that works in the low back is we'll take our sciatic sample. Usually people have, pain running down to their glute, hamstring, behind their knee or their foot. What we do is we try and get the pain to centralize. So we do this with, I use this called Mckenzie end range extension protocol. It's the gold standard for any kind of, the technical term is a radiculopathy. So what we're trying to do is get your pain closer to the source. So out of your foot to your calf, to your hamstring, to your glute, to your back, and then it all goes away. Me and Dr. Orbach both do this with corrective exercises. We can only do so much in a treatment, 1 or 2 times a week. So I'm a huge advocate of like patient home care exercises. So we go over the Mckenzie end range extension because what we are trying to do is basically close down and just get, like, if it's coming from a disc, to get the disc property to reabsorb back so you don't have the radicular symptom. Phil, any other things we use the laser therapy for? We use it for your forearm, correct?
We did. My calves.
Oh yeah. Yep. Yeah. So we use it two different times on Phil. So we use it for his calf muscle. So Phil was having tightness in his calves, both calves here. So what we did is I love working on soft tissue. So the muscle component's massive because nothing wrong with chiropractic adjustments, right? I do that all day. But if you could receive a chiropractic adjustment, all the soft tissue structures attached to the bone. So if you don't treat the soft tissue, so like the tendons, ligaments, and muscles attaching to the bone, you're only doing half the battle, so to speak, right? So for example, Phil, we got everything adjusted on him, and then we worked on his calves with laser therapy. We did some cupping, and then we did the Graston. So the Graston tool, the umbrella term is called instrumented soft tissue mobilization. So what we're trying to do is after we heat him up, he had trigger points, so his calves are really tight. So think of all his muscle fibers oriented kind of diagonal and just not a good lattice. So once we heat it up and then do some soft tissue, we're allowing his muscles to organize in a more linear fashion, so he's not as tight. And Phil, we only treated your calves like what, twice?
Yeah.
Yeah.
You did the cloud walker thing too.
Oh yeah. And then we did an FST stretch. It's called the Cloud Walker. It's called the Cloud Walker because that's how it feels after. So I always tell patients after we do that stretch, you almost feel like you're walking 15 pounds lighter. And a lot of my marathon athletes, a lot of my avid runners, when we do the Cloud Walker stretch, that really releases everything. So that is a fascial stretch technique. So you have 3 fascial lines. You have a frontal, posterior, and lateral fascial line. And what we're doing is we're stripping out the lateral fascial line. And your fascia is basically a pantyhose. So it's like connective tissue surrounding a muscle. So what we're trying to do is just strip everything out so everything can breathe. Everything's connected. So if we just worked locally just on his calves, he would feel better, but he wouldn't make a full recovery. We have to treat above and below his calf muscle just to get all the fascia, just to put more slack in the rope, so to speak. So if he's tight in his IT band or his hamstring running up, or tight down in like the plantar fascia of his foot, you're still going to have tension in the calf. But if we release below and above his calf muscle, everything's just going to be uniform, and it just allows everything to breathe. So that's one instance. Another one is if you have neck pain running down an arm. So a lot of people coming in saying, doc, hands are numb and tingly. It's waking me up at night. If I'm typing on the computer, my hands are they feel swollen, or they just don't feel as strong as they used to. Usually what I'll do is I'll start with a grip strength monitor, and we'll assess their grip strength. So we'll take a before and after. And usually I like to do at least 4 to 6 treatments to see if we could get an increase on grip strength. Another really good success story we had with the laser, Phil, I don't if you remember, we had a patient, he couldn't even grab the pen to sign his name to check out here. And after, I think it was 2 visits, he actually grabbed the pen and he was like, holy mackerel, I could sign my name checking out. So that went from, I think it was 4 or 5 years. He actually like didn't feel comfortable or cannot literally hold a pen to sign his name. And after 2 treatments, he was actually signing his name, and then he was great from there on out. So
just I remember that guy too. He was talking to me about it. He was very skeptical.
Yeah, absolutely.
2 visits later.
Yeah, I mean, and that's why I was skeptical myself too. Just because again, it just looks like a red light and it feels warm, and you're thinking, what the heck can this actually do for me? But when you actually go behind the science and just the biochemistry of how it works at the cellular level, it's a no-brainer. And we actually have like I call it the Rolls Royce. We have one of the better lasers in the greater Pittsburgh area. It's a 60-watt laser and it's continuous. Some practices that have laser, and most of them, they're like a 30-watt cold laser, and they actually do not treat continuous. So they kind of like stagger their treatment. So for example, if we're going to treat you for 2 minutes, it's going to, the treatment time, 1 second's treating, 1 second is turned off. So it's called pulsed. Ours is a continuous laser. So every second it's continuous. So you're chronically getting the treatment. It's not shutting off and turning back on, shutting off, turning back on. And again, the heat from the tissue saturation of the photon energy is what we like, just because it makes the muscles just respond a lot better. So once we heat everything up and then ship it out, you just get more bang for your buck, so to speak. So that's why, like, when I first told Jamie, my boss, I said, hey, Jamie, we need a laser. And he was like, he saw the price tag and he was kind of skeptical at first, but I said, hey, you're gonna feel the difference. We'll demo it on you first, and then we'll go from there. And he was sold right after the first couple treatments. So yeah, just little wins like that, just, I don't know, make your day, make your week for sure. I'm a very goal oriented provider. So one of my favorite things to ask patients is, whether it's due to pain, lack of function, what do you like to do that you can't do? Huge golf guy. I don't know if anybody watched St. Andrews at the old course. Cam Smith won. But I love when I get someone, in their 50s or 60s. Doc, I love golfing, but I can't golf more than 9 holes because I'm having any kind of back pain or hip pain or shoulder pain. I love having a goal to try and attain. And it could be something simple as, I just want to pick my grandkid off the floor. When I get down and I'm playing with my grandson or my granddaughter, I'm always having pain in my back. Is there any way that you could help me efficiently get down on the floor, play with my grandkids, and get up without pain? Absolutely. Again, we do that with chiropractic treatments. We do that with soft tissue treatments, so working on muscles, tendons, ligaments, with cupping therapy, instrument assisted soft tissue mobilization therapy. We do that with the laser therapy, and we do that with any kind of like active release, pin and stretch, if you will, or any kind of fascial stretch therapy. So again, very, very big with goal orientation. So if you at home just want to improve your quality of life or do something that you can't do anymore that you're used to doing, come in and we'll do a full, just biomechanical assessment to see if we could help you with what you got going on. Going back to the numbness and tingling in their hands, a lot of people, they think it's carpal tunnel, right? So they'll go to their primary care, or they'll go get like a nerve conduction study, and if it comes back just mild or moderate carpal tunnel, we can work with that. Carpal tunnel is basically just inflammation of the median nerve that innervates these 3 fingers running through your carpal tunnel. And if you don't have severe carpal tunnel, we can definitely work with that. So I'd say 9 times out of 10, if we got someone with decreased grip strength or numbness and tingling in their hands, it's not coming from their neck. So say we assess their neck, it's not coming from a cervical disc, or it's called your brachial plexus, the nerves exiting your neck. If it's not coming from there, it's usually coming from a muscle hung up in your forearm. So this is called your extensor carpi ulnaris muscle. That median nerve, the nerve that innervates these 3 fingers, pierces and runs through this muscle. So if we decrease the inflammation and kind of treat the calcium ion channel on the nerve there, and then strip out with any kind of pin and stretch of that forearm muscle, that's pretty drastic, night and day. Doc, I was having numbness and tingling in my hands, and I don't have that anymore. Just from facilitating the nerve getting hung up in the elbow, more importantly, that extensor carpi muscle, and getting some laser and some CBD over that carpal tunnel if it's mild or moderate. Um, that's another big one. Patients coming in, they're like, well, should I go for the carpal tunnel surgery? Well, let's get you a nerve conduction study. If it's mild or moderate, we could definitely treat that. Severe, yes. Well, then we have a bigger fish to fry. We might be talking about going under the knife, but if it's mild or moderate, no problems whatsoever. So that's a good example of that. Another modality that we have here that works in conjunction with everything we have is called a Normatec compression boot. So long story short, Normatec compression boots, they look, if you ever seen the Michelin Man commercials on TV, it basically just looks like just big leg sleeves that go on your feet all the way up to your groins. and it works on the principle of pneumatic compression. So basically, what it does is, let's take a toothpaste, for example. So depending on if you're the kind of person that will kind of just squeeze up, oh, I'm out of toothpaste, or if you're that person that kind of like inches up the toothpaste roll to try and get every last bit you can out before you throw it away, that's essentially what the Normatec compression boots do. Is every time you move, your cells create waste. So what we're trying to do is push all the metabolic waste and the lactic acid out of your legs by pneumatic compression. So it will start at your feet, squeeze your calves, squeeze your legs, and it kind of works everything from the distal extremity, your feet, all the way up, and then it will get pushed through your lymphatic system. Blood coming out of your legs gets highly oxygenated and nutrient dense when it goes through your vital organs, so that when you thaw out, so to speak, when all the blood rushes back to your legs, it just facilitates healing as well. So um, just another modality that kind of helps. It just makes my job easier because again, there's only so much we could do in the treatment room, but when we have tools that kind of facilitate what I do, it just helps everything just heal quicker. Yeah. Do we have any questions over there?
No, but Janice says that this is fantastic.
Nice. Yeah, yeah. So, and I keep pressing my boss for more modalities. So another one I'm trying to get in the office is called like a shockwave therapy. Arthritis. Everybody's going to get it, no matter who you are. As you age, it's a normal physiological change. So the laser will kind of help shunt and prevent the progression of the arthritis, especially if it's osteoarthritis. And we are trying to get, it's called a shockwave modality. So it basically sends like a cosine wave, like impulses, mechanical impulses into the joint to break up any kind of scar tissue and any kind of osteophyte formation. So an osteophyte is basically just degenerative change. It's just basically arthritis. And that can be used in a variety of joints. So it's mainly used for joints. So shoulders works fantastic on knees, hips, plantar fasciitis. You could use it for too. But I'm a huge advocate of just using different modalities that could kind of aid in your health. Nothing wrong with a chiropractic adjustment. I try and get adjusted by Dr. Orbach at least once a week, just because I want to know what it does for your brain and neurologically what it does for your body. But if we have all these different tools that help you, why the heck wouldn't we use them, right? I'm truly feel like I'm put on this earth to improve people's quality of life. Why not get everything we can to just make my job easier and just help you instead of getting better like this, to get better on just a more of an incline, just improve your quality of life quicker. Yep. So that is my laser therapy in a nutshell. So again, it is going to decrease acute and chronic inflammation. It's going to help the nerve, so nerve regeneration by opening the calcium ion channel on the nerve. It is going to facilitate healing, promote healing, and it helps with tissue regeneration as well. So it just helps with a ton of different symptoms. There's only a handful of contraindications. So if you have a spinal cord stimulator or a pacemaker, we can't laser over that. If you're pregnant, I'm not going to laser you, even though there's not a lot of contraindications to it. I don't feel comfortable lasering over a pregnant woman because we don't want to draw blood away from the fetus. And if you have a malignant tumor, so there's studies that people actually got laser therapy. For example, plantar fasciitis, pain in the bottom of your foot. They get their foot lasered, even if they have like a malignant tumor, like a basal cell carcinoma on their shoulder or anything like that. You could still laser. You just can't do it over a malignant site. So yeah, that's one of the tools we like to use, and it's helping a ton of people. So if you have any questions, pretty busy, but my lunch is every day from 1 to 2. Call, and I'll try and get back to you as soon as possible and answer any specific questions pertaining to what kind of injury or pathology you have, if the laser therapy is right for you, and then move forward from there. Uh, Next presentation, I am Friday at noon, and we are basically going to talk about supplementation. So musculoskeletal, right? So if you have a shoulder injury, knee injury, something like that, I'm going to talk about my favorite supplements that help with that. We're going to talk about most commonly seen things as well. So unfortunately, see a lot of people coming in with diabetes, type 2 diabetes. So I like looking at lab work, love interpreting lab work and doing supplementation protocols based off of that. So if you have any kind of recent lab work and you're going to be a new patient, please bring it in. I'd like to see it within like 6 months, but if it's within a year, we can work with that as well. And we will go over all your lab work and see what's right for you. If you're deficient in magnesium, vitamin D, if you have diabetes and your H1AC is at just not a good number, the different supplements that we can do to kind of help just ease your symptoms of what you're fighting. And we'll go through like an athlete standpoint. So if you're very active, we'll go over what you could take for your joint support, muscle support, anti-inflammatory support. If you're diabetic, we'll go over what you could take to kind of help drop your A1C naturally and get some relief from any kind of diabetic neuropathy. And we're going to talk about like concussion protocol. So post concussion, what's massive? I'll tell you right now, the big three things is going to be your magnesium, your omega 3s. So your fish oil, and then CBD is going to be absolutely be massive. So we're going to talk about the most common conditions I see and how the supplementation will kind of like aid. And again, not getting you better just slowly. Oh yeah, I feel good, I'm getting good, but to actually get you really, really good and not good, great results, and just have you heal quicker. So that's what we're going to be talking about on Friday. Yeah. So nice talking to you guys. Come down and see us. We're going to be open until 7 tonight, right, Phil? And I am here this week, Monday, Tuesday, Wednesday, Friday, and Saturday. Again, my lunch is 1 to 2. So if you have any kind of like any questions that pertain specifically to you, or if you want to talk about it behind closed doors, come in, and we'll get you on the book. We'll talk about it over my lunch, and look forward to meeting with you guys. So enjoy the rest of the week. Have an umbrella today. It looks kind of crappy out there.